Welcome. Many of us spend more hours in a seat than we do in bed sleeping. Anywhere from getting up in the morning, driving in our vehicle, getting to work, sitting in our chair, on a computer, watching TV, on a sofa. Wherever you are, we're sitting. And the sitting puts a tremendous amount of load on the lower discs of our spine. It limits good posture because it generally causes forward rounded shoulders along with a forward head postural position, weakening the anterior deep flexors because of that long looking down. If we're typing and writing and reading, whatever we're doing, generally we spend most of our time looking down. But it also plays a tremendous burden upon our hip flexors. Look how I'm sitting here. I'm sitting at 90 degrees from my upper thighs to my upper torso area, putting excessive contraction on the iliopsoas, the hip flexors. This is a big problem. This is what leads to significant problems of anterior pelvic tilt. This causes irritation and weakness on the disc, which can cause the annular fibrosis to become weaker. The inside gel called the nucleus pulposus can actually protrude out into the annular fibrosis, causing bulging and herniated discs and leading to spinal and disc degeneration. The ultimate problem is pain, pinching on the nerve root. One of my favorite stretches, the seat lunge. Something you should be doing every day. This will really help that lower back, help those hip flexors. Sitting in this position is no good. Hip flexors being contracted, that's going to pull your pelvic forward. That's going to cause low back pain and spasming. When you get up, you're going to notice that you feel like you're hunched over, like you can't even stand up straight or sit up straight because those muscles, those hip flexors are pulling. They're pulling deep in the abdominal area. It affects many other areas, structural areas that are biomechanically trying to work the way it's supposed to, and it can't. So this seat lunge, very simple. How do we do it? You're going to turn sideways on your seat. You're going to keep the front leg bent at 90 degrees, leave the foot on the floor. Back leg comes back behind you. The one buttocks and leg is on the seat. The other buttocks and the other leg is behind you, off the seat. You can hold on to the seat behind you just for stability. You can put your hand here if you like as well. The objective here is this. The objective is to keep that back leg straight, okay? All right, as much as you can keep it straight. And I want you to contract the quads, the front of the thigh, contract it. And as you contract the thigh, hard as you can, just contract it, sit up straight and lean as high as you can upwards with your upper body, and you'll start to feel those hip flexors behind you here really, really stretch and open up. You can hold that anywhere from 45 seconds to a minute. Great stretch. And then you can relax and you can do the other side. So, just a reminder, you're going to turn sideways on the chair. Front leg bent at 90 degrees, the knee, foot on the floor, buttocks and the front leg are on the chair, the buttocks and the back leg is off the chair. Straighten the back leg out. Contract the thigh, the quadricep muscle, and bring your head up to the ceiling, up to the sky. And as you contract that quad, you're going to feel that burning right in the groin. That's the iliopsoas muscles. I know this is going to make a big change for your lower back. It's going to help you particularly prevent a lot of problems as a result of postural deformation and instability from the things you do every day. I do recommend you try to get up more often from a seated position to prevent this forward head posture and pronated shoulders and degenerative changes that potentially can be occurring without you even realizing it. So do this exercise regularly. It takes 2 minutes. 1 minute on one side, 1 minute on the other. And once you get this exercise down, it's going to be a charm for you. You're really going to appreciate it. It's really going to help you significantly. Do this at home, do it at work, but try to do it daily. Very simple, just a minute on each side. I'm excited to hear how well it's going to do for you, particularly if you are a chronic back sufferer. Leave your comments below. I ask you to share this video with others. Subscribe if you haven't so you can continue to receive more self-help videos. And most important, make it a great day. I'm Dr. Alan Mandell.